I'm Colleen Sullivan with Mercy Ships Canada. On August 9th, we're beginning our first ever field service in the Congo. And the Congo is a new country for us, and we're so excited to have been invited there. However, when I tell people that's where we're headed next, the first thing they always say is something along the lines of like, whoa, isn't that place kind of dangerous? And the truth is, the Congo has a bit of a bad reputation. The Congo that you often hear about in the media is actually the Democratic Republic of the Congo, whereas the nation that Mercy Ships will be working in over the next 10 months is the Republic of Congo, a neighboring but totally different country. The Democratic Republic of the Congo, or the DRC, or Congo-Kinshasa, has absolutely undergone some horrific atrocities. But the Republic of the Congo, where Mercy Ships is traveling to, is an entirely different nation. It's separated from the DRC by the Congo River. Their capitals, Kinshasa and Brazzaville, just across river from one another. The Republic of the Congo is a much smaller country, both in landmass and in population, with about 4 million people, mostly living in either Pointe Noire, where we will be docked, or Brazzaville, the capital, or in one of the small towns scattered along the railway connecting the two cities. From what I hear about Pointe Noire, it's safe, European in feel, and expensive by West African standards. It's one of the most developed cities in this part of the world, and it's also a major seaport and tourist destination. Because Pointe Noire is relatively developed, our 10-month field service will focus on selecting patients from the interior of the country, where medical facilities are inadequate and many NGOs don't operate. The goal is to provide healthcare services to people who do not have access to care. The travel to Pointe Noire can be very long, and patients may have difficulty finding accommodation in the city. Mercy Ships Hope Center will tackle this problem. The Hope Center, HOPE stands for Hospital Outpatient Extension, is the largest one we have ever built. On this field service, we are also seeking to provide more training programs than ever before. Mercy Ships volunteers will train local doctors both on the ship and in their local hospitals. The medical training will influence the skills and capacity of the healthcare professionals throughout the Congo. The fellowship program for eye surgeons is a good example of appropriate sustainable training. These doctors learn how to remove cataracts utilizing a method specifically designed for the African climate and the equipment they have available. And the doctors are left with skills that last long after the ship's departure. So, in summary, on August 9th, Mercy Ships began a 10-month field service in Pointe Noire, Congo. Not the Democratic Republic of Congo, but the Republic of Congo, by far the safer and more stable of the two. Our time there will be spent doing what we always do: surgeries, training, and capacity building projects, and bringing hope and healing. I hope that you're excited about this as we are, and I invite you to please follow along with us as the journey unfolds. You can like us on Facebook, or you can sign up for our e-news on our website.